for K2 postnatal training. We're going to discuss some of the functions and benefits of the K2 system as we work through the course. It's important to stress that Athena is intended to supplement, but not to be a replacement for your clinical judgment. And please feel free to ask questions throughout the course as needed. Okay, today's session, we're going to be covering a scenario where the patient has had an instrumental delivery, suffered heavy blood loss. She's developed sepsis, so baby and mum have been transferred to transitional care and are receiving treatment with IVs. Okay, we're going to be looking at NEWTs. The baby is bottle fed and receiving 4 hourly OPS. I'm just going to share my screen with you. Can please somebody let me know when you can see it? Okay. Can you all see the screen?
Yes, we can.
Okay, so you log into Athena through departmental icons, and your login will be using your existing username and password that you use for network. Okay, so right, so first of all, we're going to be searching for our patient. There are 2 ways to search for a patient. One of them is using the search bar at the top. You click on that and you can search by using password, username, first name, hospital number. Okay, so the second way we're going to look at finding a patient is the one that I recommend for your nursery nurses, is locations and transitional care ward. Okay, so for this session, we are going to be using Natasha Young. So we click on the 3 dots next to the patient and we go to view inpatient notes. And then it comes up with this screen. So for nursery nurses, the main tabs you are going to be using are the baby OBS and checklists. So first of all, we're going to click on the baby OBS. And if you see down the left-hand side, you will be using most of these tabs. So the first one we'll look at is the NEWTs 2. So we'll look at the chart first, and there are OBS already in there. So we'll go to baby OBS. And we're going to add some new observations. Okay. So for this scenario, we do temperature of 37. Do 45 rests per minute. Rest status is normal. Heart rate we'll put as 125. Colour is pink and normal. If you put anything other than pink or normal, it will ask you to do a saturation level. But if it's pink and normal, that blanks out, so you don't need to do it. Okay, baby's responsive with good tone, feeding well, and no concerns from parents. Okay. Let me click on the next button and it will give you the triggers and the thresholds. Okay. So and we're going to finish. And if we go back onto the NEWTs 2 chart, you can see the OBS we've just put in have now pulled through. Okay. Next thing we're going to look at is baby assessments. Baby assessments is what you do on the lilac stickers. So for this, we're going to add new assessment. So we're going to keep the timers now, but obviously if you go back and you can change the time as needed. We're going to do face to face. You don't weigh the babies every day, but when you do weigh, this is where you would put in. We're not going to weigh it today. We're going to say skin and colour is normal. And there's no jaundice. Next. Mouth and gums are normal. Eyes are normal. If you put anything other than normal, there is a comments box you can write in as well. I'm going to say bowels have been opened and it is yellow. Baby's passed urine. Cord status is normal and sleeping is normal. And there's your baby assessments we've just completed. This baby has already had assessments completed on it, so you'll see a running commentary of what's been going on. Okay. After every tab you have done, you can click on baby comments and we can add a contemporaneous note. So there's no concerns for this baby. We can write assessment completed or whatever you need to write in there. Okay, and that gives you a running commentary of everything that's been told on this baby. We've got feeding. Going to add a new feed. We can do it as now or we can change the time as needed. This baby is formula fed. If your baby is breastfed, you obviously click on the options and you have to do a start and time end of feed as well. So I'm going to go formula fed, buy a bottle. This baby's had 40 mils. No help was given, but they did have skin to skin contact. So it wasn't a supplement for breastfed. And we're not going to raise it to a specialist, but what we can say is 2 hourly feeds under supervision. And all these notes come through. Because we've just clicked a note on there, we'll go back into contemporaneous notes, and we're just going to add a note here, 2 hourly feeds to supervision. As you can see, the more we write, the contemporaneous notes start to include. If you want to record a blood glucose, you can record it on the Newts too. We would recommend this if you're just doing random blood sugar, but if you're doing monitoring, such as if you've got a baby whose mum had gestational diabetes and you need to do it regularly, the best place would be here. So if we add new, blood glucose will put us 3. Finish. And you can see, then you can see a trend. Okay. We've got neonatal. In the neonatal one, we're going to jaundice. So if you need to do bilirubin, so babies develop jaundice, you'd put the reason, the cause, the treatment. We're just going to say no, but we are going to say we've measured the bilirubin at the moment. You still need to do the charts for this, and the charts will be put in the buff notes afterwards. So these are the charts that you get your values from, that you've been using up until now. Once a midwife or a doctor has completed an IP, if you click on here, this is where you will see it. This one hasn't had one done at the moment, but this is where it would appear, and you can go in and view that to assist with your care. If your baby is on IV antibiotics, this is where the midwife will document what antibiotics they're on and how much they're having. So they would just add new, write the antibiotic and dose, but they would still be using the drug charts as normal. Okay. Next, we've got blood spot screening. Add new, the time you've done it. We've gained verbal consent. We've explained all the reasons for it and they've accepted them. We've taken a sample. So I've done it on the foot. Done it now, and we've done it in transitional care ward. Write the card number and expiry date. Obviously we haven't got a card, so I'm just putting random things in, and then your own name. Say you're the one that has done it. Okay. We can go back into contemporaneous notes and we can just say was that taken on left foot, card has been. So everything we've done is obviously charting throughout. We've also got safe sleeping assessment. You can add new. You just follow that through as normal. We won't be looking at going through it today, but this is where you would find it. Okay. Next, we've got checklists. So these are the checklists that you do on the back of your purple book, your baby discharge checklist. So you go through your checklist as normal and then end with the baby checklist. So have you checked the address, the safe sleeping assessment, has that been completed? You click yes, and then finish. That's not changed anything. Your breastfeeding checklists. All that. So everything on here is what you normally do. It's just finding them in a different way. It's very simple. All the areas are listed on the left-hand side. So in your baby OBS and your checklists. Please make sure you log out when you've finished everything. So in your baby comments, you can write anything that you would normally write in the purple books. I know you do hot cot checks and incubator temperatures and things like that. And you also do the tube competencies for mum and dad. So you still do them on the paperwork, but you document on here that you've completed them. Is there anything else you would like to ask? Because that is about it.
Thanks, Sharon. We were just discussing what are we going to do about pain assessments? So would you just like us to put that in as the comment thing that you just
Yeah.
Okay.
Yeah, because there's not a pain assessment tool there, is there?
No. And if you're putting in the blood glucose, like when you said for mums that are going to be if babies that are needing multiple blood glucose, does that automatically backplot to newts or not?
No, it doesn't. That's why we say do it on this, because then you can actually see a trend. Whereas if it's on the newts, unless you do a newts OBS every time, so let me just click on that. But if you do a newts, it's going to ask you to do the whole of the OBS every time. Whereas if you're just doing a blood sugar, you're better off just doing it on the glucose because it's going to ask you for everything else as well.
Okay.
Can you add in on that? So where it said, if you say your colour's pink, it won't ask you to do the stats. Sometimes we just do stats anyway because it's been asked for. Can you add that? Will it let us add it?
Say that again, sorry.
I said on the bit where you said about the baby's colours pink normal, it'll just skip the SATs. But sometimes we do SATs, we're asked to do SATs on babies for whatever reason. Can we?
You can just write unsure,
Oh,
write
okay.
these SATs in, and on the next page there is a comment page, or you can just write it in the comments why you've completed the saturation levels.
I think that's our main questions. Thank you. So in the comment bits, I think the way that we currently use the purple notes, the nursery nurses will write quite a lot of information in there about kind of introduction to parents, milk, and all of that stuff. So that just goes in the comments. It feels like it's going to be quite like data rather than like the narrative around the care.
Yeah,
I don't know.
So a lot of the data pulls through, but in your comments, you literally write everything you would do normally in your purple book.
Okay.
Yeah, because this will be your S-bar when you're handing over to the community teams. They can come on here and they can see everything that's happened with baby whilst they've been in transitional care.
So we're not going to, so our community babies that come in now, we're not going to be sending the S-bars out to the community. This will replace S-bars.
Yes, yeah. So everything you write on here needs to be up to date and factual, because this is what they'll be looking at to see what's happened with baby whilst they've been in hospital.
Okay.
That makes sense?
Yeah, I think we're just trying to think about how that would work with a baby that is coming to be seen on TC from the community. I guess they would have been referred from the midwife.
Yeah.
So they know to come in, and then that midwife will just pick it up, because normally we send like the S-bar to say that they've been admitted or not.
So the community midwives have got the same system. They will have the same system, so they have access to everything. They will write on here as well.
Yes.
That's the word we're on. How will you know?
Alerted the thing to like the babies gone home in outreach, going to go and do some bloods on them.
Yeah. Are they alerted to anything like that? So we're obviously running the home phototherapy now as well. So we're taking babies. So is it like the midwife's responsibility to check what's going on? How do we alert the community team to
The midwife should be checking. So when they're discharged from TCW, it will go down behind a window for the community midwives to pick up. So as soon as they pick it up, they will have all the information there.
Okay. Okay, thank you.
Is there anything else you can think of? So I know I had a couple of questions about, is there going to be a jaundice sheet attached? I think there may be eventually, but there isn't at the moment. So you do still need to continue doing the paper jaundice one. Somebody asked about the outreach section we've just spoke about as well, that when you do phototherapy at home, everybody will have access to the same system. So you should all be looking at it. Sorry,
are the community midwives taking iPads with them on visits? So they're documenting at the visit rather than going back?
Yes. So there is an offline part of it. So everything they do, they can still do offline. And then when they go back to their base, it will automatically update everything.
Fine. And just from an outreach point of view, are we going to have access to that? Because we're seeing obviously the community babies for SBRs and home phototherapy now as well.
Yeah, I think that's something we need to discuss with Francesca.
Okay.
I know everybody who's had the training has got this access. So if your nursery nurses are doing the phototherapy at home, they would still access the same notes that they do in the hospital, the contemporaneous notes and things like that. So they still have all access to that, as far as I'm aware.
Okay. I think that's all of our questions.
It is quite a simple system. It's quite intuitive.